This is FYI on your TV, brought to you by Hometown News. I'm Kathy Botham. I have got Andrea Selich back with me. You are the Director of Audiology at Hearing Solutions. Thank you very much for coming back to FYI.
Kathy, thanks for having me on the show.
We are going to talk about November being Diabetes Awareness Month, and there is a connection with hearing loss and diabetes.
Absolutely. So, I think it's so important for us to alter our understanding of our health in general. We tend to think of health problems in like a vacuum, like my hearing problem is just a hearing problem, or my diabetes problem is just a diabetes problem, when in reality, so many of our health conditions are intertwined. And I think this is a perfect example of that. I think some of the consequences of poorly managed diabetes are a little bit more well understood. People know about having, good foot care or kidney care or eye problems, and hearing isn't maybe one of the ones that's on people's radar, but it's a risk, just the same as some of these other problems for some of the same reasons. When our diabetes is poorly managed, those high or low blood sugars can damage hearing nerves or vascular supply. And just as blood supply is so important to things like the kidney or the eye, our hearing nerves are very, very demanding when it comes to oxygen supply from our blood. And so when they're deprived of blood supply as well, these are very, very tiny blood vessels. We also risk damaging our hearing nerves as well. So much so that diabetics have twice the risk of hearing loss compared with the general population. And even those with prediabetes are at much higher risk, a 30% increase for those individuals.
I always made the connection. I knew there was a connection with kidney disease and proper foot care and circulation, eye problems and everything. I never made the connection with hearing loss.
For sure. And, this ties in with other research that's connected to things like our cardiovascular health. One famous cardiovascular specialist is suggesting that, the ears might be the window to the heart, that when our cardiovascular health suffers, that blood supply to other areas of our body that need good blood supply show the signs first. And so often people with poor cardiovascular health are indicating hearing loss showing up as well. And so another good reason that, if we're detecting problems in some of these other systems, it could be telling part of a bigger picture. So this is some of the recommendations for people then with diabetes, and the recommendations to manage their diet appropriately or manage their weight or exercise might seem sort of obvious or straightforward because we hear these things all the time, but I think they do show how everything is connected. And so if we can exercise well, we manage our weight better by doing that, we manage our cardiovascular health, we improve blood supply to the periphery, whether it's our feet or our hands or our ears or our eyes, we're doing a good thing for our overall health for sure.
And it's one thing, when you have diabetes and you start having some problems, but sometimes, and so often, people who have problems with their vision, they get tested, then they find out they've got diabetes. It could be the same thing with getting your hearing checked. It could be, you've got to get some more help.
Absolutely, it's very, very true. And the way hearing loss presents itself for most people isn't so obvious. It tends to show up very, very slowly, and we tend to be very good at compensating for hearing loss as it develops. And so we learn coping mechanisms, and we can therefore put it off. And so it's a real call to action when we're noticing little things in our world that might be tipping us off that a hearing loss is developing, whether it's increased need to repeat or timely right now difficulty communicating with masks could be something that's tipping people off, finding that you're turning the TV volume louder than maybe the person who you watch with. Any of these little things that might be tipping us off that, hey, there could be something going on, is really a good indicator that, I should probably have a hearing check done, because that way we could be catching things, identifying things early, and that can only serve us.
And you mentioned coping mechanisms, and sometimes people have good coping mechanisms, but sometimes when they don't, it could lead to other things. I saw a video you did recently too. I mean, if you're not getting your hearing checked and you're not coping well with it, you could become depressed. It becomes a mental health issue too.
Absolutely. We don't necessarily recognize that we're changing behaviors. When communication becomes more strained, people can change their behaviors and maybe withdraw more. And it's not a conscious thing. It can just be as simple as, oh, well, I'd be okay going out to the buddies or going out and playing cards or whatever. And if that situation becomes a challenge where, I'm having to strain to hear and exert more energy, maybe it's less fun. And so we don't do things like that as often. And those kinds of changes in behavior are not good for us. They're not good for our cognition. So hearing impairments linked with things like cognitive decline, for instance, when we're not getting that social stimulation. As you mentioned, things like depression and anxiety. It's manifesting in a lot of different ways. And so we're always urging people to have their hearing assessments done. If people find that an intimidating process, minimally going online and doing a hearing screening is an easy thing to do, because that can be another thing. If we're doing a screening that we can just do online in our own home, then that can let us know whether maybe a more advanced test is required or whether they can safely put it off for maybe a little bit longer. But certainly we should be doing it earlier. And if anybody has a family history for diabetes or knows that they have diabetes, that would be a call to action to do it much sooner. So we're generally recommending for the population in general, somewhere around age 55 to consider having a baseline hearing screening done. For people who are at higher risk, maybe doing it sooner around age 45 is a good idea, because some of those studies that showed the increase of hearing loss in the diabetic population were showing it in populations much younger. The one study was showing even age 20s and 30s with some of those individuals having hearing loss, with a pretty steep rise for people in the age 40 to 50 kind of category. So or somewhere around 45 for people with diabetes or a risk of diabetes, and maybe around 55 for the general population.
And you have told us before too, we go and we get our eyes tested every year or two. We go to the dentist every 6 months. We should get a baseline on our hearing as well.
Absolutely. It certainly doesn't hurt, and it can work against what the data tells us. The data tells us that people tend to put off managing their hearing for somewhere between 7 to 10 years in most cases, which only makes it harder when it comes to finally deciding to treat it, because we've then given our brain a decade to getting used to hearing the world with reduced hearing in certain areas. And so that changes our perspective on what we think is normal. If we get used to not hearing certain sounds, and when it's time to reintroduce them, it can be very, very challenging.
Absolutely. I can imagine the shock, somebody putting a hearing aid in and thinking, this is how I'm supposed to be hearing. There's going to be
Absolutely.
a whole new learning curve.
Yeah, I remember dealing with a specific patient, and they're very alarmed by the sound of their own breathing, and they thought we'd done something wrong, and we had to say no, when you're breathing, inhaling and exhaling through your nose, it creates some turbulence there, and that's a frequency range that you weren't able to hear before, and readapting to even some of those normal sounds of life then can be very challenging for people if they've gone a long time without hearing some of those sounds.
Wow. Can you tell us, what does a hearing test look like or hear like? What does it look like when you go for a test?
Absolutely. It should be a pretty painless process. The first part of it's good counseling. So there's a lot of talking involved, because we want to uncover what people are experiencing, what some of those things that they're happening in their life that might be explaining problems they're having. So we do a lot of talk to uncover what someone's lifestyle is like, and that's going to help us steer treatment if treatment is relevant for an individual. So first part is usually counseling, taking a good case history and just understanding what people are experiencing. From there, we'll do a look in the ear. We tend to make use of video otoscopy, so we can often show our patients what we're looking at in their ear as well. But minimally, we do a traditional just look in the ear, make sure everything's healthy, rule out blockages and inflammation and things like that. Then we do a quick pressure reading on the eardrum. It's a very, very brief test where we put a little bit of air pressure in the ear. Sort of feels the same as like when you take an elevator ride. And that lets us know whether the eardrum is intact, whether it's too stiff or too loose, or if there could be an infection in there. And then following that, we typically take people into a sound booth, which is like a little sound-treated room with a window in it. And in there, we present the individual with different sounds, typically very soft sounds, and they indicate whether they can hear those different sounds at different pitches or frequencies. We typically do a little bit of speech testing as well. So either read or play a recording of a list of words to see how well they're able to comprehend speech. We do the same in noise, because speech and noise is one of the earliest areas where people with hearing loss start to notice problems. And so doing a speech and noise test can be very, very informative as well. Particularly in that some people have greater problem separating what they want to hear in noise than others. And so we typically do a speech and noise test as well. And once we have all that information, we typically then have a complete picture of what's going on. And we share that information and let people know exactly what's going on with their hearing and if any further steps are necessary.
Now, typically, do you think you have most people come in and get a hearing test because they themselves know that they have an issue, or, excuse me, their son or daughter or wife or spouse says, okay, you need to get your hearing tested?
It's quite variable. We do see a lot of people who are willing to put it off for themselves, and they say, you know, it's fine, I don't have a problem. They don't realize that they're impacting others as well. So it is very, very common for children and spouses to help be that last little push. It's funny, what we're able to put up with ourselves is one thing, but when we see the impact to our loved ones, that often can be the last little nudge that motivates us to do something. For sure. There's a well-known professor in our field that says, you know, when one person in the family has a hearing loss, the whole family has a hearing problem, because ultimately communication isn't just about us. You know, I put my glasses on and they're for me. They're only really affecting me. Nobody else sees the difference. Nobody else really cares for the most part. That being said, when it comes to communication, it's not just us who we're communicating with, it's everybody else who we're communicating with. So a hearing loss often impacts others in addition to ourselves.
Absolutely, and that's a perfect way to put it too, because so often, you know, you may be with somebody, you have to repeat something for that person, you know, it's like, what did they say? What did they say? You know, and you are the communicator, you're the interpreter almost, you have to speak louder for the person who spoke. So yeah, I could see that, absolutely. It's a family thing.
Definitely.
Yeah, that's right. That's right. So November is Diabetes Awareness Month. I'm so glad you contacted us and we can do this. And we've got to be more aware of your hearing loss when you have diabetes too. But again, too, you could get your hearing tested and find out you have some diabetes issues as well too. So those are good indicators.
Absolutely. It's all about our overall health. It works both ways, right? When we're doing good things for our hearing, we're doing good things for our health. And when we're doing good things for our overall health, we're probably doing good things for our hearing too.
Absolutely. So what's it look like with the COVID now and pandemic, being able to go in and get your hearing tested? What's it look like?
Our clinics are open and happily seeing patients. I mean, we were open as an essential service throughout the pandemic as well. But people are definitely showing increased willingness to come in. Because of that, things are a tiny bit busier, and that people who probably would have come in earlier aren't coming in right now. That being said, we're still absolutely able to see our patients, and we're more than happy to do so. So I wouldn't at all want that to be something that discourages anyone from coming in.
How do people get a hold of you then?
Online's a great way. So hearingsolutions.ca is probably the best way. And find a clinic that's close to you. And if that feels, again, even a little bit intimidating, we have an online screener on our website as well, and that's a good starting point for many people.
Excellent, excellent. Well, I thank you very much for joining us. Andreas Seelitz, you're the Director of Audiology at Hearing Solutions. Thank you very much. We always learn so much when we talk to you. I appreciate it.
It's my pleasure. Thanks again for having me on the show.